Hi there, I just want to take a few minutes to discuss with you the difference between chronological and developmental ages. When we are working with children or teens or adults for that matter who have had a trauma history, we want to look at these so that we can mindfully respond in an effective way when there are any issues or behavioral concerns that come up. So let's just look at it this way. So from a chronological perspective, we talk about it being a chronological ladder. Basically, we have the rungs of the ladder and we start at birth and we move up the ladder to whatever age we are in years. Developmentally, we have the rungs of the ladder very similarly, and we start at birth and we move our way up as we move up developmentally through stages. And so what's important to understand about this is that at any given time when we're working with children or teens or adults, we can chronologically be a certain age. So let's say 16 years of age. But when there's a particular traumatic stress or a situation that creates trauma, re-traumatization, or toxic stress for an individual who's experienced a previous history of trauma, what can quickly happen is that they move down their developmental ladder. And this most often comes out in behavioral symptoms. So let me give you an example. We might have a 16-year-old girl who has a history of traumatic sexual abuse, and she's in treatment at 16 years of age, and she in many ways is working hard, is psychologically minded, and doing a lot of really good healing behaviors, but at the same time becomes impacted by certain consequences from a parent that she feels may be unwanted or unwarranted, or that she just doesn't agree with. During stressful situation, she may move down her developmental ladder to a 3-year-old. And what that might look like is, screaming, name calling, slamming doors, sort of temper tantrum-like behaviors. So what do we do? What do we do as professionals? What do we do as parents? Well, what's first and foremost important is to be mindful and recognize the difference between the chronological age, basically the bone age of the child or teen or adult, versus the developmental age. So we will know that if we're trying to respond to the girl in this case that I'm giving a scenario about, as if she's 16, so we might think, well, we can reason with her, we can apply logic. Once she's moved down the developmental ladder, we can't apply the same strategy. So what we want to apply is things that would seem more reasonable for her developmental age. And what that might look like is something that you might do as a parent with a 3-year-old who's having a temper tantrum. You would never, for a 3-year-old, get positive results if you sit them down and say, oh, it's okay, let's talk this through and let's, figure out what's happening. Let's problem solve this. What you might do with a 3-year-old, if they're having a temper tantrum, say in a grocery store, is you might actually pick them up. You might kind of hold them close and, say to them, I'm here, you're safe. I can tell that you need some comforting. You might not even use words. You may just offer them food or a drink. You might stop grocery shopping if it's happening in the shopping center and move outside and have a different sensory experience. And as they calm down, what we would see of that 3-year-old is that they're listening, they're smiling behaviorally, they're engaging in a very different way, and therefore they begin to move up. And we want to do the same thing, but we want to make sure that we're applying age-appropriate strategies. strategies. So for that 16-year-old who's moving down her developmental ladder, we may offer some different sensory items. We may offer a blanket. We may offer just some time away for her to calm down. We would not reason with her, not try to problem solve, but rather allow for a different calming experience. We might give her a glass of water or propose to make her a cup of tea. We might just deal with this in a way that we similarly would, but age still appropriately, to help move her back up her chronological ladder so that she can respond accordingly. So I hope that makes sense. If not, you can talk with your online coach a little